National Physician Services, technology and services for physicians by physicians. Healthcare information technology has become one of the most important and challenging aspects of running a physician practice today. From patient records to HIPAA compliance and other mandates to device management and upgrades, not a day goes by when technology demands, changes, breakdowns, and enhancements don't eat up precious time and resources from your practice. That's why a group of tech-savvy physicians founded National Physician Services to deliver practice-enhancing, state-of-the-art technology services across the full spectrum of clinical and business services. Founded in Hartford, Connecticut in 2003, NPS grew rapidly and expanded to the New England region by 2007, and just 7 years later, enjoyed a national profile.
National Physician Services, we are that technology company for the medical community. We go a little bit further than providing basic IT needs. We provide support for electronic health record, practice management systems. We do integration between all of those systems that providers and users use, support the workflows that ultimately provide patient care. We recently formed what's called the Perfect Practice Alliance, and this alliance has allowed us to offer even greater depth and support of our existing services. The Alliance brings in skilled consultants and integration, skilled partners that do revenue cycle management. So we're actually expanding beyond our foundation services to offer even a greater portfolio of products, not only on a regional level, but all of our partner affiliates throughout the United States.
Today, NPS remains physician-owned, but now employs IT, RCM, and healthcare experts, an ideal marriage of people who know what they need to manage their practice and people who devote their day-to-day work to providing it. Let's take a look at what NPS, through the Perfect Practice Alliance, offers. NPS Advisory, Cloud Suite, Application Support, Managed IT, NPS Help Desk, Integration, NPS Revenue Cycle Management. Each service line can be delivered independently or bundled to offer the most economic, coordinated suite of services available today. Here's a closer look at each service line. NPS Advisory. Let's face it, you need a CIO, or Chief Information Officer. But not every office can afford to employ a top-tier IT person dedicated to their practice. The better solution? Employ an NPS IT team that knows medical practice needs and that offers all those functions an on-staff IT team would at a fraction of the cost. NPS Cloud Suite. The cloud is perhaps the technology concept of this decade. Whether you use it strictly as a backup, for remote access, as your main tech source, or for that all-important disaster recovery utility, having a cloud version of your critical applications is mandatory. And our cloud never sleeps. It's at your command 24/7, 365. Application Support. Our application support experts will recommend, implement, and troubleshoot the most effective clinical and financial applications on the market today. We'll install them, optimize them, support and maintain them. And we also offer clinical and financial performance reporting services, so you'll be able to track and improve your important practice metrics. Managed IT. This is that virtual on-staff IT person who is there to assess, recommend, fix, remediate, instruct, answer questions, provide reports and analytics, admin your system, and know how to squeeze every ounce of power out of your IT infrastructure. NPS Help Desk, a given with any good IT service provider. From desktops to mobile devices, faxes and printers, to your network, systems, and critical clinical operations, NPS has a live operator and portal support to answer your questions and mitigate problems quickly. A new addition to the NPS service line is Revenue Cycle Management, or RCM. With the recent transition to ICD-10 coding, managing your revenue cycles is more important than ever. NPS has the experience and expertise to help you manage that transition efficiently and effectively to ensure that your revenue cycles and your cash flow are optimized. For a free initial assessment of your practice needs, contact us today.